COVID-19 pandemic has illuminated for some and reinforced for others the negative impact of systemic racism. Many public health professionals knew early on that this pandemic would devastate the Black community. We have seen in the Black community higher rates of death, and in some cases, death rates being 3 times higher in the Black community compared to other populations. This pandemic has touched every aspect of our lives: health, economics, leaving many Black businesses struggling and even closing their doors, and education. We have seen the education achievement gap widen during the course of this pandemic. We now have the tools to put an end to COVID-19, and we can do that by following public health guidelines such as getting vaccinated, wearing masks, and continuing to socially distance. We are a resilient community, and through faith and determination and the proper investments in our neighborhoods, we can get through this.
Hello, I'm Dr. Bohema Pinto-Smith, and I'm a physician in emergency medicine. Pastor asked me to speak to you about why you should get the COVID-19 vaccine. The vaccine is available to some of us, but in the next few months, the plan is that it should be available to all adults. So the number one reason to get the vaccine is that it is highly effective in preventing you from getting the virus in the first place. Now, nothing in life is 100%. That includes the vaccine. So if you were to get COVID-19 after vaccination, the chances of having severe illness or death would be quite low. Additionally, a lot of studies are showing that the chances of transmitting the virus, if you didn't know you had it, is going to be low too. So these are the reasons to get vaccinated. Now, the question is it safe? That's what a lot of us are thinking. We got to keep in mind that the vaccines were tested in tens of thousands of people before the FDA approved it to be safe for usage in the general population. Additionally, in the last 3 months since the vaccines have been available, over 109 million doses have been provided to people in just the US. That's a lot of people and a lot of experience gathered about how it works, the side effects, etc. Now, you cannot get COVID-19 from the vaccine because the vaccines don't have the live virus in it. There are some side effects that you could get though. Some people will have nothing, but a lot of people will have mild side effects. And it's really just your body telling you that it's responding to the vaccine as it should. If you were to get side effects, they're quite temporary, just a few days, but really talking to a lot of people, on average about a day. In the emergency room, personally, I'm not seeing people there with side effects, either mild or severe, from the vaccine. So in summary, COVID-19 has affected the whole world, but especially the Black community. So once the vaccine becomes available to you, we really recommend that you get the vaccine to protect yourself and your family. If you have any questions about the virus or the vaccines, the CDC website is the best place to start. Thank you and God bless.
A vaccination pod held here at the Metropolitan Baptist Church yesterday was such a big success, the county says they're going to have more, especially now that their vaccine supplies are ramping up.
Getting the COVID vaccine into the arms of historically underserved populations isn't easy. Albany County Executive Dan McCoy says when he stopped by the vaccination clinic at the Washington Avenue Armory earlier this week, just 3 African Americans were there getting their shots. He says localized vaccination pods seem to be the solution.
They don't want to get on bus transportations. They don't want to take a cab. They don't even want to get in their families' cars.
On Friday, McCoy, joined by Albany County Legislature Chairman Andrew Joyce, said they're engaging the community's churches, organizations, and local leaders to identify where there's a need and bring the vaccines to them.
Even though we have these big vaccination efforts opening up at the Armory and we have them going on at UAlbany and so on and so forth, we need to continue the pressure, get it in the neighborhoods, get it in the communities where it's needed the most.